One. Now we have prevalence of chronic venous disease in primary care centers in Azerbaijan, the VeinScope study. Maybe we have a film or a video. No?
Thank you.
Thank you. Welcome.
Yes. Okay. Good morning. First of all, thank you for having me here. I'm glad to present you our research about the prevalence of chronic venous disorders in Azerbaijan. And as you know, chronic disorders significantly alter the quality of life for the affected patients right from the early symptomatic stage. And the impact of chronic venous disorders in the general population is often underestimated and not well recognized by the health system. It's also often overlooked in primary care and cardiovascular care because of an underappreciation of its scale and of the impact of the disease. It's our disclosures. The aim of this study was to detect these patients and update the information on the prevalence of chronic venous disease and its stage in accordance with CAP classification. Also, we evaluated the treatment status of CVD patients and the tactics and steps of GPs undertaken in order to manage these patients. The study was organized within the framework of ordinary consultation with general practitioners trained in the use of the CAP classification. Women or men over 18 years of age applying to general practitioners, whatever the reason for their consultation, informed of their involvement in the program and agreeing to take part. Despite of the reason for consultation, the patient was asked about venous symptoms. Then patients underwent leg examination. Management tactics, whether it was a treatment initiation, prescribed medications, or referring patient to specialist for the management, was also recorded in the form. Recorded information was collected and analyzed. We provided GPs with such kind of questionnaires. The questionnaires consist, as you can see, the general information of the patient, the symptoms of CVD, circumstances when these symptoms appear. Then the doctors indicated the class of CVD according to CAP classification. In the second page of questionnaire, we indicated the ongoing treatment for CVD if the patients had care for venous leg problems. And then the GPs should indicate what they suggested to patients. Treatment initiation, change or continue the ongoing treatment, ultrasound examination or referral to specialist. If they initiated a treatment, they were required to indicate which treatment they proposed, lifestyle advice, compression stockings, active drugs, topical treatment, etc. We also provided such kind of appendix for GPs for insurance. The study included 3,249 patients, and the prevalence of CVD was 48.5%. Significantly higher in women than in men. And as you can see, the greater the age, the higher the prevalence and the more advanced the CVD. Only 26.9% of patients had consulted with their physicians due to their problems in the lower extremities. In the rest of cases, the reason was for searching GP consultation was various complaints. And as you can see, most of the patients were treated for diabetes, heart problems, and blood pressure. The most frequent symptoms in the overall sample were the sensation of heavy legs, 77%, leg pain, 65%, and swelling, 55%. And 81% of patients mentioned that they had experienced 3 and more CVD symptoms. The distribution of the patient in accordance with the categories of CAP classification is presented. And as you can see, C0S in 18.9%, C1 48.72%, C2 12.75%, C3 14.72%, skin change C4 4.63%, and health ulcers and active ulcers about 1.5% of patients. Recommendation and treatment was provided in all symptomatic patients by GPs, and it was considered necessary to refer only 5.4% of all of patients to specialists. In 62% of patients, it was considered necessary to establish treatment. In conclusion, that chronic venous disease is highly prevalent among the patients seen at primary care clinics in Azerbaijan, especially in women and elderly patients, and the referral to a specialist is uncommon. Thank you very much for your attention.
Thank you very much. It was really very interesting. Questions from the floor? I'd like to ask you some questions because we have very few information about Azerbaijan.
Yeah.
Maybe there are some similarities with Hungary, where I'm coming from, because this is also more or less Eastern country, and there are Western countries which are a little more on a higher level of health service. So I'd like to ask you that how many colleagues are dealing with venous problems in Azerbaijan? How many vascular surgeons or phlebologists, or how is this there?
How much
How many colleagues are there?
Colleagues. 3 years ago, it was our first Venoz Forum, and I collected about 40 phlebologists.
Mm-hmm. And how many are the inhabitants, the population of Azerbaijan?
It's about 11 million.
How much?
11 million. 11 million, yes.
Yes. Okay, and I saw that the prevalence of crural ulcer is under 1%.
Yeah.
In Hungary, it is above 1%. And is there some genetic positive thing that there are fewer crural ulcers in Azerbaijan than in for example, in Hungary or in other countries?
Thank you. No, I don't think so. I think the patient who had the ulcers, they directly come to phleboligist, not go to the primary care for consultation.
Yeah,
I think the patient. I think it's above the 1%, but it's only the patient who had a consultation for GPs for other problems. That's why the people who had the ulcer or who have the ulcer in Azerbaijan, actually, when they see the ulcers, they saw that it's a very difficult problem, and they go directly to the phleboligist, not go to the GPs.
Yeah. So I am interested in just in these days I could speak to a colleague who works in the United Kingdom, and he went maybe to Wales or somewhere else, and there. Within the United Kingdom, there are big differences in the size of varicose veins. And what is the size in Azerbaijan? Are the patients active to go to seek for a solution of their problems, or they don't really do anything with varicosities?
Yeah, it's also the point that you mentioned that maybe our country is a little bit similar, because our people don't tend to go to the specialist actually with varicose veins. They go only when they have some symptoms. When they have some pain, okay, for example, the patient has varicose veins, and this patient don't go to the specialist. But when this patient have a pain, they also think that maybe this pain is related to the varicose vein, and only in this case, the patients come to the specialist, but generally they don't tend to go to the specialist.
And may I ask a question? Which kind of treatment do you prefer in Azerbaijan for varicose vein or symptomatic varicose vein? Traditional surgery?
No, we
radiofrequency?
No, we make an venous treatment. And we have all options. For example, I make a radiofrequency, laser, mechanical chemical ablation, clarivein, and also cosmetics procedures like a CLAX. And we have all options in Azerbaijan to treat such kind of patients.
Okay. And which treatment you do personally?
All that I mentioned. Some patients, for example, we have a radiofrequency device. We have a radiofrequency. We have a laser. we have a Clarivain, and I decide in each patient what I will use.
Do you perform traditional surgery also?
No, I did, but about 3 years ago, I left.
Completely abandoned.
Yes.
Completely abandoned.
Yeah.
Agree.
Also, recently I did the patients with a big vein with a size about 5 centimeters with endovenous laser ablation, without any incision.
What is the main occupation of people there in Azerbaijan? What are they doing? Agriculture, or in a factory, or?
Generally, you mean the people occupations?
Yeah.
Generally, the agriculture, but a lot of people also work for oil companies, because we have a lot of oil.
A lot of oil?
Oil. No, not olive oil.
You are a friend.
Yeah, petroleum. Okay. Yeah.
Oh,
Okay.
It is very interesting. And who is this organized there? That there is the National Health Service and private practice?
Yes, but national service is a little bit in a low situation, because we have a primary centers. This was left us from Soviet Union, and it's only the one way to have some medical help without payment, and but it's not in a very high position in Azerbaijan. Actually, people who have the money, actually they come directly to the private hospital. And I'm also working in a private hospital.
Or sometimes they go abroad to be treated?
Yes, in some cases, yes. But after I'm in Azerbaijan, maybe a lot of people stay and treat in our center. But actually, they like to go to somewhere, to Iran or to Turkey, for example, because we are near to our country. And yes.
Where did you study phlebology?
In Russia, in St. Petersburg, in Medical Military Academy.
Yeah. Who was your teacher?
Shaydakov, yeah.
Shaydakov. Yeah. Okay. He's a good. Okay. So we are sorry that this is the situation.
Yeah.
So, and do you do sclerotherapy as well?
Actually, I do cryosclerotherapy. Yes, I use both of the plaques. Yes. Yeah.
Were you there in Sao Paulo?
What?
In Sao Paulo, Kazuo Miyake.
Yes.
You learned from him?
Not from him, because I a little bit modified it. I use actually more, more energy for treat the varicose veins, and for example in the Brazil. And
did you try also simple sclerotherapy with a solution like etoxysclerol or fibrovein, or so simply?
Simply, yeah.
Or why do you think CLUX is better than simple sclerotherapy?
I think in some cases a very small telangiectasia, it's not good treated with the sclerotherapy. Very small, thin capillaries, and it's very good treated by laser. Really, or with NDIAC, it's very good treated.
Yeah. Okay. And do you use compression stock? What is the weather there? What is the climate?
Actually, it's hot now. Actually, it's because we are South country, and actually it's hot. But we use also compression stockings.
And compression stocking is accepted. The compliance is good.
Compliance is not so good, but we try to treat also the patients. We provide them some paper how you can use. Also, you can see how you need to wear from YouTube, for example. We say like this.
So, any questions from the floor? This is a very rare opportunity to speak to an Azerbaijan colleague. Yes, thank you very much.
Thank you very much.
We have time, but thank you very much.
Okay. So let's go on.